Hello everyone, in this video we are going to discuss about acne vulgaris. Acne is also called as a pimples, common skin disorder particularly in teenagers. So acne is common skin disorder characterized by pimples, comedons, pustules and sometimes nodules and scarring. These are the different forms of acne and it is common skin disorder particularly for the teenagers. It is a condition where hair follicles are plugged with oil and dead skin cells. Patients having acne problem have sebaceous glands which are hyper responsive to androgens rather than having an overproduction problem, overproduction of androgens. Important points related with pathophysiology of acne are increased production of sebaceous gland, hyperkeratinization and excessive desquamation of the epithelial cell, formation of comedon, proliferation of locally present propionibacterium acne and few staphylococci, and local inflammation. So these are some important pathophysiology related points associated with acne. So we will discuss one by one of them. The first point is increased production of sebaceous gland. We all know our skin is made up of different layers. Epidermis is the outer layer of the skin which is waterproof in nature. Second layer is dermis, which contains sebaceous gland and it secretes the sebum on the surface. Sebum mainly contains triglyceride, means we can say that this sebum is made up of lipids. Sebum carry dead cell outside the hair follicle. What is the function of sebum? It carries dead cell outside the hair follicle. When there is increased level of testosterone, there is increased level of sebum, and this excessive production of sebum leads to excessive production of protein called as a keratin, and it causes a condition called as a hyperkeratinization. So these 2 points are clear here. What is hyperkeratinization? Hyperkeratinization means due to increased level of sebum, a protein called as a keratin increases, concentration of protein keratin increases, which called as a hyperkeratinization. And when there is a mixture of this high keratin and sebum which blocks to the hair follicle, it leads to comedon. It leads to formation of comedon. Comedon have two different types. Either it is closed or open. When it is closed, it is called as a whiteheads, and when it is open, it is called as a blackheads. Next point associated with bacteria. There are certain bacteria which are responsible for acne problem. The first problem is with propionibacterium acne, and second one with staphylococci, and local inflammation. Irrespective of any type of acne, inflammation is there. So these are some important points associated with pathophysiology of acne. Next, drugs related with acne. The first drug is a cleanser. We can use cleansers such as soaps, comedolytics like local retinoid, adapalene, exfoliants like salicylic acid, sebostatics like oral isotretinoin, hormones, cyproterone acetate or estrogen. Some antibacterial agents are also there. Either they can be applied locally or systemically. Examples of such local antibacterial agents are erythromycin, clindamycin, azylic acid, benzoyl peroxide, and examples of systemic antibacterial agents tetracycline, erythrom. Okay, so now we'll discuss all of these agents one by one. The first agent is retinoids. These are a derivative of vitamin. Retinoid and isotretinoin are first generation retinoids which are used for management of acne. Third generation retinoids like adapalene and tazorotine are less irritating and more effective as compared to first generation. These agents are applied topically except isotretinoin, which is an oral drug. Due to adverse effect, retinoid is reserved for used in the severe cystic acne. People should avoid sun exposure because it will increase the chances of sunburn, and these drugs are avoided in pregnancy. Means these retinoids are classified into two different types. Either they are first generation or they are third generation. Examples of first generation retinoids are tretinoin and isotretinoin, while examples of third generation retinoids adapalene and tazorotine. Advantage of third generation retinoid is they are less irritating and more effective compared with first generation. All these agents are locally applied, or they can be used locally, except isotretinoin, because isotretinoin is a oral drug. There are adverse effects with this tretinoin, so they are reserved for the use in the several or severe cystic acne. The patients taking the retinoids should avoid the sun exposure because it will increase the chances of sunburn, and these retinoids are contraindicated in the pregnancy. Next category is benzoyl peroxide. They considered as a first line agent for mild to moderate acne with no inflammation. Means if the patient have problem of acne and symptoms are in between mild to moderate range and there is no inflammation, we can use benzoyl peroxide as a drug. Mechanism of action include antiseptic action against propionibacterium acne as well as opening of pores. Next is salicylic acid. Salicylic acid is very common in OTC products. Its chemical composition is it is a beta hydroxyl acid which work on acne by exfoliating the skin. It has a keratolytic properties and it can be used in the concentration range of 0.5 to 2%. Its indication is it can be used for treatment of mild acne. Next is azylic acid. It is dicarboxylic acid and have an antibacterial activity against propionibacterium acne as well as anti-inflammatory action. It is used for treatment of mild to moderate inflammation acne. Skin irritation is the most common adverse effect associated with azylic acid. Means it has a one differentiating point. Other drugs we cannot use for inflammatory cases, but this azylic acid can be used in the case of inflammatory acne. This is a very important table. So there are different drugs associated with different symptoms of acne. The first is mild cases without inflammation. If the patient suffering from mild cases of acne without inflammation, what are the different drugs which are available? Examples of such drugs like topical tretinoin cream or gel, adapalene in the concentration of 0.1% as a gel, salicylic acid or benzoyl peroxide. Second category is mild cases with inflammation. We can use topical antibiotics, benzoyl peroxide or combination of erythromycin and benzoyl peroxide for 4 to 6 weeks. Severe cases with inflammation. If the patient having severe cases of acne with inflammation, then topical tretinoin plus systemic antibiotic therapy. If response is unsatisfactory, particularly in multinodular cystic lesions, we can add the oral isotretinoin. So these are some important points associated with the acne, pathophysiology and treatment related.